On the 3rd of March every year, the international community commemorates World Hearing Day, organized by the World Health Organization (WHO). Activities take place across the world, and an event is hosted at the WHO in Geneva. The campaigns aim to share information and promote actions towards the prevention of hearing loss and improved hearing care. With the first event held in 2015, this year's commemoration marks its 10th anniversary. World Hearing Day 2025 has as its theme Changing Mindsets, Empower Yourself to Make Ear and Hearing Care a Reality for All. This encourages people to recognize the importance of ear and hearing health and seeks to inspire positive changes in behavior to protect hearing from loud sounds and prevent hearing loss, as well as regular checkups. On Nigeria Today, we shall delve into the important issues around healthy hearing practices. Thanks for joining us. I am Rikaria Clinton. Now, with me in the studio for the conversation is Dr. Umezikam Mbanaso. He's a consultant, ear, nose, and throat surgeon at the National Hospital, Abuja. It's a pleasure to have you in Nigeria today.
Thank you very much.
Joining us via Zoom is Dr. Muhammad Sani. He's an ENT surgeon and a chairman, World Hearing Day Committee, National Ear Care Center, Kaduna. It's a pleasure to have you in Nigeria today.
Good evening, and thank you for having me. I'm really excited to be with you.
No, let me start with you, Dr. Mbanaso. You know, we often hear people go for eye check, some go for, dental care. But would you say people are really going for or doing same for the ear?
Thank you for that question. In my opinion, I don't think it is as much as those who go for the eye or for the dental checks. And I think a lot of it has to border on awareness. So that is part of why we're celebrating World Hearing Day on a day like this. We need people to be aware of practices they engage in that put them at risk of hearing loss. We need people to be aware of occupations or activities they do that put them at risk of hearing loss. We also need those who are exposed to activities with hearing loss to recognize warning signs of hearing loss and know what to do. We also are also campaigning for the government to improve access to ear and hearing care services across the federation. It's interesting to note that in Nigeria, we have one ENT surgeon to over 500,000 people. And what is recommended is one ENT surgeon to about 25,000 people. So it's a big challenge and a big problem for us. So I don't think people are really, accessing ear care as much as they should.
Okay, thank you very much. Now, Dr. Sani, now when it comes to ear care, what are the important points one should, remember?
Well, thank you. One of the most important points generally in healthcare is understanding that these conditions are preventable, and that if you institute the right preventive measures, you would.
Okay, it's like we've lost him there due to maybe network issues. So, okay.
Problem. I think. Yes, are you with me now?
We can hear you.
I was saying that one of the most important thing is the understanding that conditions leading to problems of the ear and hearing, most of them, up to 60%, are preventable. So understanding that you can actually protect yourself from your actions or inactions from getting ear or hearing problem is the key. It's one important message that we always want to pass to the general public. Once you can prevent your losing your hearing or having ear problems, then it's sorted out. The other thing is that the knowledge that almost any or every cause of hearing loss is curable. Actually, some people feel that when you are born with hearing problem, you should live with hearing problem and die with it. But it doesn't go that way. Every hearing problem, every cause of hearing loss is treatable, including genetic hearing problems and problems that comes with defects in the brain. They are all treatable. So once people understand this, I think they would have a change of mindset about what hearing loss is all about.
Now back to you, Dr. Mbanaso. You earlier on you talked about some harmful practices people indulge in that could lead to hearing loss. Can you tell us some of these practices?
Okay. I want to start off with the most common, which is the use of cotton buds. Yeah, so many people are at, at risk of ear damage when they use cotton buds. I know that people feel that wax is dirty, wax is smelly and slimy, and they need to take it out.
And it's itchy too.
Okay, it could cause some itching sometimes. But the truth is that wax is designed by the body to protect the ears. It helps to trap dirt, dust, and deal with microorganisms that could be harmful to the ears. And so people who engage in using cotton buds or feathers or broomsticks or whatever into their ears, or matchstick in their ears, they could cause damage to their ear canal. They could further push in the wax. They could damage their eardrums, and that would cause hearing loss. It will actually worsen their problem. Another problem that we see is what part of what WHO has focused on this year, which is recreational noise exposure. We have more young people using headphones, AirPods, going to clubs and being exposed to loud sound. The interesting thing to know is that prolonged exposure to loud sound damages the inner ear. The inner ear is very delicate. So prolonged exposure causes progressive damage, and it's actually irreversible. So that is a very harmful practice. People who are exposed to loud sound because of their jobs, also need to have some kind of protection. And they also need to go for regular ear checks so we can detect if there are any changes in their hearing, so that we know how to adjust their schedule or modify their work so that they're still effective and useful without damaging their hearing. Some people go and pick up over-the-counter medications, and some of them are harmful to the ears, and they could also cause irreversible hearing loss. So those are very common practices that people engage in. People pour in all sorts of drugs and chemicals into their ears in a bid to treat ear infections. These are some harmful practices that need to be discouraged. And that is why we have a day like this, to bring awareness to people about practices like this and let them know what they can do when they have such conditions and what they need to do so that they can improve their ear and hearing care.
Okay. Now, back to you, Dr. Sani. Dr. Mbanaso has mentioned the use of cotton bud, that it is very, very dangerous, the matchstick and the rest of them. Most times or sometimes you're tempted to use these things, especially when you have some kind of an itchy thing in your ear. So how do you take care of your ear when you have a situation like that, when you have some itching in your ear or something like that? So how do you take care of it?
Well, itching in the ear is commonly caused by two things. It's either you have a skin allergy or there's an infection, most commonly a fungal infection. Most often it's just usually a reaction by the skin to some foreign material. But commonly, especially when you have discharge from the ear, it's from infection, especially, like I said, fungal infection. So it goes without saying that treating the primary problem is actually the thing to do, not the scratching. The scratching will just continue and then cause trauma to the ear, and then infection will be a bit more. So there's a way we teach people to scratch the ear without putting something inside their ear. there's a little bulge in front of the ear here, and then we teach them to push that and rub it a bit. For minor itching, that solves the problem. However, like I said, if it's an infection, it has to be, you have to see a doctor who will treat that before the itching goes. If it's allergy, it also has to be treated with appropriate medication. So those are the things to do. Either mild itching that you can just use your hand outside to rub it off, or see a doctor to treat your infection or allergies.
Now, Dr. Mbalaso, of course, he has said you can do that. Maybe put your age, maybe just you can share our viewer how we can do that so that they would.
All right. So there's a triangular cartilage in front of the ear, right? Call it the tragus. So you use one finger and gently occlude the entrance of the ear, and then rock it gently up and down, for some time until relief is felt. We call it the tragal rub.
Okay.
And it's effective.
What if it doesn't stop the itching?
If it doesn't stop. So if it doesn't stop, it might suggest a more serious underlying condition.
Okay.
And then you need to come in and see us. Yeah.
Most of the time when I hear ENT surgeons or ENT doctors, so I will ask, what is really the connection? Sometimes your ear will itching, you'll be doing your throat will be, making some kind of sound if it will help. So what's really the connection?
So the ear, nose, and throat are all interconnected. There's a connection between the middle ear and the pharynx, which is the area behind the nose, and it's a continuous channel downwards to connect with the oral cavity, the mouth, and it continues into the airway and into the esophagus, which is our food passageway. So they're all interconnected. They now have a rich network of nerves, so stimulating a nerve in the ear sometimes could reflect in the throat or in the nose, as the case may be. Problems in the nose can spread to the middle ear or can spread downwards into the oropharynx, which is the communication between the nasopharynx and downwards into the airway and food passageway.
Okay, another thing I want to find out is, most of the time you see people that have ear problem, like they can't hear. People that have, how do they call it now?
Deafness. Yes.
They find it difficult to talk very well.
Yes.
So, what could be the reason? Is it possible to have someone that can hear, but the person can't talk? Or,
Okay, so the truth is that speech requires hearing to be acquired. Hearing is required for language development and speech development. So when someone is unable to hear, they are unable to talk. Some people develop hearing loss after they've been able to gain speech, right? Now, they can talk, but when they lose the ability to hear, it now interferes with their feedback. So we refer to those people as postlingual hearing loss. They can't speak. Their speech developed to some extent, but because they stopped hearing, it has now affected their speech. Such people could replead, and sometimes you see them shouting because they're unable to really modulate, their voice, how loud or intense their voice is. So it's just that interconnection that explains that. Yeah.
Okay. Thank you very much. We will take a short break now, and the conversation will continue after the break. Don't go away.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow under digital economy for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that our questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today. It's good to have you back. This is still Nigeria Today, and we are looking at ear care. And of course, I have two gentlemen, one in the studio and one via Zoom. Now, Dr. Sani, this year's theme says changing mindsets, empower yourself to make ear and hearing care a reality for all. Open our minds to this and why, you think this could be, apt for this kind of celebration.
Yeah, well, the philosophy behind changing mindsets comes from the fact that a lot of people are not aware, they are not educated about causes and remedies to ear and hearing problems. And this knowledge or understanding of the causes and how to prevent oneself is key. It's very important to reducing the number of people who have hearing problem. Like one example is what we have mentioned now. A lot of people feel it's okay to just put a cotton bud or a needle into the ear and scratch your itch or remove wax. While we know that the skin of the ear is really very, very delicate and the eardrum is also close by. So any slight thing can actually injure the skin or even perforate the tympanic membrane and result in hearing loss. So these are really common beliefs. And one of the problems we have is people using hearing aid. I always give people the example that you don't find it difficult to use glasses when you have visual difficulties, but people have stigma in wearing hearing aid when they have hearing problems. So it's up to us. I mean, it's one of the aims of these changing mindsets to really explain to people that this is okay and the benefits outweigh any possible stigmatization. People don't like you said, the first question you asked is about people going for visual checks, but they don't go for hearing checks. I think it's it's a hidden disability. Hearing loss is a hidden disability. I mean, people will see a blind man on the way and help him, but when you see a hearing disabled person, you would not even know. You would not notice. So it's up to us to understand that there are a lot of people on the way that have hearing problem. And I'm happy that NTA has provision for this sign language when they are broadcasting news. These are things that have been advocated to help people with hearing problem. Captioning is also advocated. So this kind of misconceptions or lack of knowledge about how to take care of the ear or the problems that arise that causes hearing loss. Another example is people really, especially in some parts of the country, they have negative tendencies around immunization. And some of the commonest causes of hearing loss in children are immunizable diseases. Diseases like meningitis, like mumps, like measles. They are really common. They are seasonal things that come and go away, leaving a lot of children with hearing loss. So these kind of misconceptions are our targets. We want to change people's mindsets and empower them with knowledge to change their practices and ensure that their children and their adults have their hearing conserved. This is the aim of the theme, really.
Thank you very much. Now, Dr. Mbanaso, you talked about some of these dangers of that we, of course, some of the things, harmful practices that we can do. Well, then, how often should one go for ear checks? And how do you know that you're beginning to have maybe ear problem?
Okay. Let me start from your second question. One easy way is that the patient begins to request for people to repeat, communication information or, whatever someone says. Another thing is that you begin to want the volume of your phone or your radio or your TV set to be increased. One of the ways we often ask parents about their children, we ask them, does the child always go to the front of the TV or is the child always tuning up the volume of the TV? So that's one easy way to identify hearing loss. Some people also develop a ringing in their ears. We call it tinnitus. That's another, way to know that there's a problem. And then sometimes people around you begin to complain. Oh, we are calling you or we're talking to you and you're ignoring us. Those are subtle ways one begins to know that there's a problem. Talking about how often we need to check our ears, the truth is that hearing loss can occur anyway along the lifespan of an individual, right from conception through the growth of the baby, down through adulthood and in old age. So there are key times when we recommend that the hearing should be assessed. For instance, at birth, we have what we call the neonatal hearing screening program. We're trying to see if it can take up and gain full speed in the country. Some few centers are beginning to take it up. We begin once the baby is born. As the baby goes for immunization, the baby goes for an ear check. There's some basic tests we can, perform for the child that does not need the child's response. We begin to know if there's a problem or not. During early childhood, every clinic visit a child, engages in, the ears should be checked. The pediatricians try a lot in that regard and refer the patients appropriately to us. In adulthood and adolescents, it's important to check the ears at least once a year. And then those whose occupation put them at risk of developing hearing loss, you need to check their ears at least twice a year. In the elderly, there's what we call age-related hearing loss. As people get older, the hearing mechanism begins to fail, begins to fade away. So such people need to check their ears a little bit more frequently, at least twice a year in the elderly people, so that we can detect these changes and institute appropriate care.
Okay. Now, for the children, are they more prone to these to ear infections? Because you mentioned, you talked.
Yes. So children are more prone to ear infection.
So why is that?
Okay. So it's interesting to know that the eustachian tube, which is a tube that connects the area behind the nose to the middle ear of children, is shorter, is more horizontal or flat, and is wider. So that makes it easy for children who develop runny nose or infections in their nose or their throat to easily have ear infections. So that is why the pediatricians are always making it a point of duty to check the ears of children. Then again, children, their immunity is still developing, still evolving. Their body is trying to recognize, pathogens and problems and bugs around. So they are at risk of developing infections very frequently. And so it easily spreads into the middle ear. There's another condition which we call otitis media with effusion. It causes painless hearing loss, and the child does not, complain of pain, but that child is not hearing. That child does not respond to calls. The child is performing poorly. The child's speech is also not well developed. So such children need to have their ears checked.
Okay. Now, Dr. Sani, knowing the challenges we have, as a country, Dr. Mbanaso has said that we have, one ENT doctor to about 500,000 patients. What should be done? What should stakeholders do to ensure that we have at least meets to a reasonable extent the recommendation, which is 1 to 25,000, will I say patients now?
Well, the main answer is, I think, in training more manpower, training specialists at all levels, and not just doctors, but audiologists and nurses and other technicians that are needed for to provide hearing health care. This is worsened by the current JAPA syndrome that has taken a lot of senior doctors who are supposed to train younger ones away to greener, what they call greener pasture, really. So we need to increase the number of training institutions we have, the number, especially for ENT residency training. We need to increase the number of universities that provide audiology courses and then even lower polytechnics that can provide audiology technician education programs, and then the nurses. Currently, there is only one center for training of ENT nurses in Nigeria, and it's in Kaduna. You can imagine how it can cater for the whole of the country. That's really not possible. And then the training centers are not many. Where they are found, they are really small. So we need to encourage.
Dr. Sani, we have to stop here. Thank you so much. That was Dr. Muhammad Sani, ENT surgeon and chairman, World Hearing Day Committee, National Ear Care Center, Kaduna. Thank you so much for your time and your contribution.
Thank you for having me.
And of course, with me in the studio was Dr. Omezikam Mbanaso, consultant, ear, nose and throat surgeon at the National Hospital, Abuja. Thank you for your insights.
Thank you very much.
We hope to have you again here again.
Thank you.
And thank you for being part of the program. Don't forget, Nigeria Today airs every weekday at 7:30 p.m. on NTA News 24. You can also check out this episode and others on www.youtube.com/NTA News 24 Hub. I'm your carrier, Clinton. Goodbye.